17 days after Mom's passing, I took him in and they told me that they believed Dad had Alzheimer's disease and Dad was 59. So I found myself at the age of 29 in charge of 2 adult men with progressive neurological disorders, both leading to dementia, and my 1-year-old son.
Katie, welcome to the show.
Andy, hi. Thank you so much for having me.
Of course, my pleasure. Before we get into it, though, we have a Patreon here where members of the village who are supporters of the show are able to ask the guests a question. You ready for what they wanted to ask you?
I'm ready.
All right. The question was, caring for my mom is a full-time job. How did you balance the time and emotional commitment of being a caregiver to your husband, father, and young child?
Wow, what a question. I even ask myself that from time to time. So I think that what is helpful is exactly what was stated at the beginning of the question. Being a caregiver is a full-time job. Acknowledge that to yourself and know that bringing it into your life, you're going to need to start juggling because balance is going to feel unrealistic a lot of days. So I remember waking up in the morning and I would ask myself, okay, who needs me the most today? And that answer might be, well, Dad has an appointment with his primary care, or I need to go to the skilled nursing facility to meet with Mike's care team because he's having some behavioral symptoms that are challenging. Maybe Noah woke up with the sniffles or an earache, and so then that would change the course of the day, or the babysitter would call out sick. It just felt like this constant whack-a-mole of trying to deal with big and little fires, but just also trying to keep some sense of fun um, as a part of the day.
So when you said you have to kind of balance between them, do you think that this dynamic was only possible because Mike was in a care setting? Do you think that if Mike, your dad, and Noah were all living with you, it would be complicated? And if so, how would you recommend navigating that?
So the answer is yes. I realized very quickly that as one adult, I was not able to keep my infant son, my husband with behavioral variant FTD, and my dad with young-onset Alzheimer's disease. He was diagnosed at 59, all safe together in the same space by myself because I was only one person. Sometimes I had to go to the bathroom. Sometimes I was taking a shower. Sometimes I was sleeping. I remember my sister would say to me, why does every crisis start with you saying, I was in the shower, I was in the bathroom? And I thought, because I'm not watching them when I'm doing that. And caregivers should have the right to, pay attention to their bodily needs and take care of themselves as well. So that is a great way to think about it. If you're not able to care for yourself while caring for your loved one, then that means you need extra help. I've heard it before. A life care manager once said to me, the time to think about bringing in help when your loved one is more than a one-on-one. Well, what does that mean, more than a one-on-one? It means that if your loved one's not safe while you're cooking a meal in the kitchen, answering a phone call, using the bathroom, switching the laundry, like there are times running a household where you are occupied by the running of the house. And if you need another person to keep your loved one safe, then that means they're more than a one-on-one. So I was not able to keep Mike, Dad, and Noah all safe together by myself. So it was so helpful to have the assistance of a skilled nursing facility that could care for Mike. And then I could manage Dad and Noah together.
So, Katie, how did you make the determination of where to or when to it's appropriate time for Mike to end up in a skilled care setting? Because I feel like there is a almost guilt I would feel. It's like now I have to pass this along. Can you talk about that?
Yes, I want to talk about this. One of the most important things that I think I can do. Uh, and really, you're asking two separate questions, right? So if we think of the logistics of where should care be provided, and then a separate question is how do we feel about it? And sometimes those things match and sometimes they don't. So first, let's think about where should care be provided? Oftentimes, persons living with a diagnosis will say, I want to stay at home. That's my goal. I want to stay at home. I want to be with my loved ones and have them care for me. And so then I'll have a caregiver. This could be a spouse, an adult child who says, well, I promised my loved one that I would care for them at home. So if I don't fulfill that promise, I'm breaking a promise. I'm failing. But the reality is people living with dementia, whether it's caused by Alzheimer's or FTD, they have different and unique care needs. And they have different and unique environments. So one person may live in a home where everything is on the first floor and there are no stairs to navigate. And another person might live in a place where the bathroom is really small and it's hard to have a second person in there helping you. You have to think about safety first and foremost. Many of the caregivers that I work with today are surprised. They think that their loved one's going to move into a facility solely based on the stage of the disease. But often it's much more based on the caregiver's ability to meet the needs and the environment's ability to meet the needs. So I I think of the example of a lovely couple that I worked with where the wife was very petite and the husband was very tall and broad. He had a lot of motor issues. He had a lot of falls. He needed help on and off the toilet, in and out of the shower, and his wife could not physically lift him. So they needed the help of a memory care facility so that they would always have staff, so they'd have a handicap accessible space. And then his wife could be there as his advocate and support and as his wife, but she needed help to provide that physical care. They weren't safe at home alone together.
Was she able to live in this instance? Was she able to live with him in the memory care facility, or was she having to drive and commute there just to be with him?
She drove and commuted, and that was her choice for her own well-being. They were a young-onset couple, and so it really wouldn't have been the best environment for her. Um, and I think that she did go through, as you know, I did. I felt a lot of emotions, but when my husband need to be placed in a skilled nursing facility, but one of the emotions that I felt was gratitude because for me, we weren't safe at home together. So think of my scenario and Mike's specific symptom of my scenario. I'm home with a husband with FTD, a dad with Alzheimer's, and a baby. Mike would get up in the middle of the night and feel compelled to go for a walk. So now I had to make the choice as a caregiver. What am I going to do? Am I going to follow my husband with behavioral variant FTD, who I know is impulsive and not making good choices and also having trouble communicating? Am I going to follow him in the middle of the night? That means I'm leaving my sleeping baby and my dad alone in the house. Or am I waking up my infant son and bringing him with me? Am I calling the police to say that my husband is out wandering and I can't leave? Like, it just was so stressful, and I found that I wasn't sleeping, which then meant that I couldn't be my best self during the day to be a parent and a caregiver. So I felt immense gratitude that there was a bed in a facility that I thought was wonderful, just 9 miles away from our home, and they were willing to accept Mike. We know that patients, people living with behavioral variant FTD, especially our younger men, can experience discrimination from care homes who are worried that they won't be able to meet their needs. And sometimes they'll just say right up front, oh, we don't do FTD. So I felt really lucky because I knew that Mike was safe in his skilled nursing facility. I knew that I could go and see him anytime. And then at night, I could sleep knowing that everyone was where they were meant to be. And it just helped me cope with managing the symptoms.
Yeah, Katie, that's tough. That's a lot there to reconcile. But I think now is probably a good time, Katie, to introduce you to the audience. Katie Brandt is a global advocate, national dementia care expert, and director of caregiver support services at Massachusetts General Hospital Frontotemporal Disorders Unit. And as a former co-chair of the U.S. National Alzheimer's Project Act Advisory Council, CEO of Katie Brandt Advocacy and From Care to Cure podcast host. Katie harnesses the power of lived experience as a family caregiver for the past 17 years to advance person-centered care, influence policy, and illuminate the authentic voice of those who have lived alongside dementia, inspiring hope that the cure of tomorrow is not so far from the care of today. Katie is also the creator of a short film, Love Is Out There, which was a runner-up for the 2016 American Academy of Neurology's Neurofilm Festival. Katie, there's a lot here to unpack, and I think that your story is going to resonate with families, and if they haven't already connected with it so far. So can you tell us about your story? How did you get into this space? Because I don't think, based on what we've said before, I don't think that this is a place you really saw yourself ending up or wanted to be in this space. Instead, you kind of ended up here, and now you're working it well.
Yes. I have an unusual story, but the thing that's common is that my introduction to life with dementia was unexpected and unplanned for. Most families will say, I didn't plan to be a caregiver of a loved one with dementia. It just happened. My husband and I met in undergraduate college. We both went to St. Anselm College in Manchester, New Hampshire, in the States, and fell in love and got married shortly after graduation. We both went on to earn our advanced degrees, mine in nonprofit management and public policy. Mike earned his in philosophy. And then we started working together. We had jobs that turned into careers. And around our fifth wedding anniversary, we found out that our son Noah was on the way. And it was around this time in our marriage, in our life together, that I started noticing changes in my wonderful, smart, sweet, funny husband. His behavior changed. He was more impulsive. He became more withdrawn. He was having trouble at work, like so many things. And after bringing him to 8 different medical and mental health professionals, Mike was accurately diagnosed with behavioral variant FTD at the age of 29. At that time, our son was a month away from his first birthday. And Mike was diagnosed on a Friday. And my mom and I were incredibly close. And, we may talk more about how, she played a significant role in helping me think about Mike's behaviors as something medical, something that needed medical investigation and detective work leading to his accurate diagnosis. But
So, sorry, on that point, did she were you aware that these things were going on, or did you gloss over it and say, "It's just something, it doesn't matter, it's nothing"? Were you kind of doubting it, and her from the outside was really noticing it?
yeah, I can distinctly remember a conversation that mom and I had. I was sitting in the car. We were on the phone. Noah was asleep in the back seat. And I, you know, was talking about things that Mike was doing that seemed weird or were frustrating me as a wife and a new mother. And I mentioned that Mike had an appointment with his primary care physician coming up, his annual appointment. And my mom said, "You need to go to that appointment and you need to ask the doctor if something is wrong with Mike's brain." And I said to my mom, I said, "There's nothing wrong with Mike's brain. He's just being a jerk." That's what I said. And, I give myself grace for that. Of course, felt terrible that, I didn't realize it, um, as I think as early as mom did. But over the years, now I've been with the Boston area FTD caregiver support group, first as a caregiver and then as a facilitator. So I've been with the group for almost 18 years. Many partners, adult children, family members, think that their loved one is having a midlife crisis or acting out in some way. It's not easily recognizable as, oh, this is a progressive neurodegenerative disease leading to dementia. So I think that that's more normal.
So can you continue on your story of what you were saying earlier before I interjected with that question about, talking about how you ended up down this road and what you were experiencing with Mike when he was 29?
Yeah, it's a good question. Mom and I were just talking throughout the weekend. And then that Monday, I went to work. At the time, I worked for the New Hampshire Division of Children, Youth, and Families. I managed programs for child abuse prevention in the state of New Hampshire. That Monday evening, Mom and I were talking on the phone. We'd been on the phone for an hour and 13 minutes. And she said to me, it's late. The baby is sleeping. You should be sleeping. I'll talk with you in the morning. And that night, Mom went to sleep and she had a heart attack in her sleep and died. And 17 days after Mom's passing, I brought my dad for a follow-up appointment with his neurologist because Dad had been forgetting things. He had gotten lost on the way to my sister's house for dinner. It just a lot of strange stories. He had a negative performance review at work. So he'd been going to the doctor, and this follow-up appointment was on the books. 17 days after Mom's passing, I took him in, and they told me that they believed Dad had Alzheimer's disease, and Dad was 59. So I found myself at the age of 29 in charge of two adult men with progressive neurological disorders, both leading to dementia, and my 1-year-old son.
And what was your immediate response? Like, how did that impact you? What did it feel like? Suddenly you have a few months earlier, probably everything's feeling good. You're feeling, the world is your oyster, as they would say. Things are going in a good direction with a young Noah. And then all this kind of comes crashing on you.
Well, I mean, Noah was such a dream. Like, I think I wanted to be a mom since I was 8 years old. My own mother, our whole family, we just couldn't wait for Noah's arrival. So what an incredible time to, be a new mom. I was doing important work that I loved. We lived in a lovely community with friends. And so you're right. It did feel like our whole future was in front of us. And in many ways during that time, I kept picturing it was like Noah and I were standing on this like little patch of land and like everything else around us was just burned down. I've had this visual of like everything that you thought you had is gone. Felt like a very violent time of life in many ways, because so many things changed so abruptly and without warning. I had never heard of FTD. I didn't know that young people could get dementia. Of course, I didn't think I would lose my mother so suddenly. My dad, I think that probably was less shocking. What was shocking about it was that it happened at a time where I had this new responsibility as a mother, a new responsibility now as a caregiver, and then the loss of mom, who would have been a wonderful support to me, but also now I had to manage dad. So, so much of it was at first a disbelief, but immediately I knew that I had to stay focused because I was determined that my son was going to have a wonderful parent. And I knew that in order to be a wonderful parent, I had to focus and just manage the responsibilities in front of me.
Do you think that there was some effect of stability that Noah gave you? Because when I think about FTD and Alzheimer's, not even early onset, it's every day is different. It's unpredictable. We can't expect anything. Where realistically, for a 1 year old, the progression is reasonably linear. It's reasonably predictable. We know at 12 months this was going to happen. 16 months this was going to be like. Do you think that Noah really kind of helped, as crazy as it is with a toddler, do you think that he kind of added a bit of stability in your life and consistency and something you can cling on to say, hey, have this thing that I know is going to be like this tomorrow and the day after?
Absolutely. I- I've told Noah so many times that I am so grateful for him. I could never fully express to Noah everything that he has given to me, the privilege of being his mom, but also how much he didn't even know it, but he was helping me to have a goal. So every day in little decisions, I benefited from having Noah as my anchor, right? Is this environment safe for Noah? What, how are we going to structure the day so that Noah is engaged and connected and doing well and thriving? And then integrating dad into that, or a visit with Mike. Spending time together as a family with Noah was the number one goal on Mike's care plan. You know, wanting him to have the opportunity to be a dad in whatever way was possible. It also helped me to be very clear about my decisions. So having a 1-year-old in the home and seeing that Mike was becoming really obsessed with fire. He was obsessed with leaving the house at all hours. He he would do things like sometimes take out food, not cook it fully, leave it accessible. Sometimes he would leave things that were just unsafe on the floor where Noah could reach them. It was so clear and obvious that there was a vulnerable infant in the home. So I had to make swift, strong decisions. Not every family is dealing with that. And if I didn't have Noah in the home, I wonder if it would have felt as urgent to find skilled care for Mike, right? Because with dad, I would have thought, well, dad would be okay if I had to run out of the house in the middle of the night to chase after Mike because he was still in the early stages. But with Noah, it made things super focused and clear. It also made them more complicated because there was a lot of pressure on myself. And I know that other caregivers feel this when they're juggling parenting and caregiving. There's a lot of pressure on myself to like be super mom because now Noah only had one parent and he didn't have grandparents who could fully be present for him. That's a lot to ask while you're learning a new role of caregiving, navigating new systems, trying to deal with behaviors, trying to deal with this ever present grief at the loss of the life you thought you were going to have, the people you were losing right in front of you. Um, so it was important and it was an incredible focus, but that doesn't mean it was always easy.
How would it have changed if Noah wasn't in the picture for keeping him at home? Have you reflected on what line or mark you would have had to cross where you would have said it's no longer safe? If you're saying that Noah and Noah's safety was the line of where he had to move to a skilled care facility, what would it have been like if Noah wasn't around? How would you have made that determination?
Well, this is something that I think is incredibly important to talk about with caregivers in general, is that you matter too. Your health, safety, and well-being is just as important, if not more important, than the person living with the diagnosis. And I don't say that lightly because the reality is the well-being of the caregiver directly determines the well-being of the person with the diagnosis. So if the caregiver is not able to rest, able to get the nutrition they need, able to access mental health supports or go to their own medical appointments, how can they show up to advocate and care for their loved one who is vulnerable because of FTD or Alzheimer's? So we need to think about the safety and well-being of our caregivers. I have worked with so many caregivers that put their own safety way at the bottom of the priority list because they think, well, my loved one with the diagnosis is the priority. But the reality is, by prioritizing your own well being, you're going to make the best decisions and be able to provide that loving and attentive care to meet your person's needs.
How was Michael as a dad to Noah as he was going through this?
Mike and I talked about having a family before we were even married. It was just a dream of ours, felt so natural. We were hoping for a gaggle of kids, maybe, our own basketball team. Um, and so I knew that becoming a dad was really, really important to Mike. And I think back to the earliest days at home when Noah was a newborn and I was struggling to, learn how to nurse Noah and meet all of Noah's needs and help him to grow and thrive. And I think about how attentive Mike was. And looking back, I can see now that some of the struggles that he was having were likely due to early symptoms of FTD, like just being able to cope with having a new baby in the house. But he was just so attentive and trying to help me in every way that I needed. So as Mike's disease progressed very quickly, and he wasn't able to be the dad that we thought he was going to be, right? He lost his language um, around by the time Noah was 2, Mike only had a couple of words. Um,
Wow, so it was a fast progression then.
it was a fast progression. But I will say that there's this one story that I think really emphasizes their connection. So when I would bring Noah to the skilled nursing facility, this facility was just so incredible. And because family time was the number one goal in Mike's care plan, they would assign a staff person every single time I brought Noah. So then we would be one on one, right? So one person for Mike, one person for Noah, and it could swap between myself or the staff person. I would always bring an activity and a snack. So the activity might be blowing bubbles, bouncing a ball, a hula hoop, and the snack had to be the same. Otherwise, they would steal each other's snack because, they wanted to know what the other had. So we had a visit where we were bouncing a basketball. We had our, snack on the bench. And then I was like cleaning up afterwards. And Mike and I were sitting on the bench, and Noah toddled off and picked up a large stick. He promptly came right over to the bench, took the stick, and whacked Mike in the face with the stick. I was
Oh
freaking
boy.
out. Yeah, oh my gosh, Noah, we don't hit people with sticks. My God. And I was so worried. Like, was Mike injured? No. Immediately, I see the two of them locked eye to eye, both of them laughing hysterically, the biggest belly laughs. And I thought, oh my God, they are making a memory of joy as father and son, connecting in the way that a 2-year-old and a person with moderate stage dementia can. And I took the stick away, but
Rightfully so.
rightfully so. That's appropriate. But it really opened my eyes to this idea that love and connection are possible if we're willing to think about it outside of the normal expectations.
Wow. Can you talk to the audience about the difference between frontotemporal dementia, Alzheimer's, oftentimes I hear folks initially convolute all the umbrella of dementia. So can you talk a little bit about that? Because your experience with FTD is radically different than somebody that is aging, going through an Alzheimer's journey.
Yes. So I'm not a doctor and or a scientist, and so just know that as I explain it. But I have had this very unique experience of caregiving for my husband with FTD at the same time I was caregiving or have continue to care. My dad is still with us almost 18 years later as I continue to care for my dad with Alzheimer's. So I think of it this way. First of all, what we know is that Alzheimer's tends to begin in the back of the brain, right? And that's where we have important functions for memory. That's why a typical early symptom of Alzheimer's disease that people in the general public well know is memory. Like, oh, dad's forgetting things. Oh, dad forgot the way to go to my sister's house, or, dad forgot that it was my birthday, things like that, right? Memory. Frontotemporal dementia typically presents in the frontal, which is like your forehead, frontal lobe, or temporal, like down by your temple, kind of in front of your ears. When FTD shows up in the frontal lobe, you're going to get changes in personality, behavior. Like that's where we have our impulse control. Think about the frontal lobes. They are the last part of our brain to develop when we're babies and toddlers. That's why you see toddlers who, might run across the street without looking both ways. They might say something that's inappropriate. Dr. Brad Dickerson, who's the director of the FTD unit where I work, he'll say, when there's damage in the frontal lobe, you could think of it like all gas, no brakes, right? There's a lack of impulse control. When people have FTD, excuse me, when people have FTD that impacts their temporal lobe first, that's where you're going to see early changes in communication, language, reading, writing. You may notice that your loved one is replacing words. They're using words like thing, stuff, just a real change in their ability to communicate. So with Mike, the earliest symptoms were he was more impulsive. He was more withdrawn. Socially, he changed. He used to be so outgoing, have so many friends, want to talk all the time. And I found that I started receiving phone calls from friends saying, "Is Mike mad at me? He never wants to hang out. He doesn't want to talk." And I was experiencing that too. Um, having good judgment, making safe decisions. Mike struggled with that. He started drinking more than he should. Um, Spending money, racked up $28,000 on a credit card, just doing things that he never would have done before. And so I found myself saying, I feel like I don't even recognize my husband. He's not the person I married. My dad with Alzheimer's disease, man, that memory piece is fierce. Dad wouldn't know who's the president. What day of the week is it? Did he eat breakfast? He certainly can't remember where I work or what I do for a job. But dad has retained a lot of his personality. And one thing I would notice, we think about crossing the street, dad still would, for a long time, as long as he could walk, he would look both ways crossing the street. So I think that while they are different diseases that present differently, and in the end, they attack the brain enough so that it becomes a global dementia that affects all areas of functioning. But in the beginning, they look very different.
What are we seeing statistic wise for FTD prevalence? I feel like I'm hearing about it way more, even before I entered into this, dementia world, supporting my grandmother. I'm hearing about FTD a whole lot more than I did a decade or two ago. Is is it because we're talking about it and normalizing it more? Is it because we're seeing it occurring at a more alarming rate, or is it because they're wonderful folks like yourself, Spencer, the FTD bros that are trying to talk about this?
And it's all of those things combined because what we know is that FTD is the most prevalent form of young onset dementia. And what we also know is that it can be very difficult to receive an accurate diagnosis. The earliest symptoms of FTD are changes in personality and behavior. And if they're happening to people who are in their 40s, 50s, and 60s, it may be seen as a mental health episode, a midlife crisis, changes in personality. We have even seen that people can end up having engagement with law enforcement and engaging in criminal behavior. That you have to ask yourself, well, is it criminal? Whether you're stealing or Mike, had an episode where the police became involved because he had been drinking and then was driving. No one was hurt, thankfully. But is it criminal if the person is not able to control their behaviors because of a medical condition? I think that we are still dealing with an underdiagnosed population because we know, especially in the United States, we have what are called neurology deserts, which means that for a 200-mile radius, there is not a certified neurologist. I don't know what that is like in Canada, but there are
So you're
places.
saying that in these rural areas, there isn't the supports.
There isn't the supports. And just because there's a neurologist in your neck of the woods, it doesn't mean that that neurologist is an expert in dementia. And if they are an expert in dementia, how much experience have they had with atypical or young onset dementias? Because Alzheimer's is the most common disease that causes dementia.
Hmm. So you said it was hard to diagnose. Was your husband's through the blood test how they diagnosed him, or was it behavioral based? Like, what was that like?
Yeah, so Mike was seen by 8 different medical and mental health professionals over a course of almost a year. He spent a week in a secure psychiatric unit, where he told me that it was really nice because they had free coffee every day and the TV was on all the time. I mean,
Hey, at least you got path class full, right?
if that's not a sign of, something going on here, I went to the family meeting at the end of the week where he was in the psychiatric unit, and the psychiatrist said to me, "I think your husband has severe depression." And I leaned across the table and I said, "I don't think so." I don't know why. It just never set right with me, this idea that he had depression. It it just it didn't fit. It didn't feel right, and I walked out of that meeting and I was gonna go to the parking lot, and the social worker tugged me by the sleeve, brought me in the hallway and said, "I'm not supposed to be saying this, but I think you need to take your husband somewhere else. I don't know what's wrong with him, but I've never seen anything like it." So this idea, imagine, right? Someone saying, "This doesn't look like things I've seen before, but I don't know what it is." The first neurologist who saw Mike in New Hampshire told me that he had a cyst in his brain, and also it looked like he had dementia, but she didn't know why. And the cyst that she said was actually space. It was atrophy from the FTD. Mike was accurately diagnosed because of my mom. Um, she had been bringing my dad to appointments to see what was going on with him. And, dad was young, but older and having a lot of those typical memory issues. So I think, he was on a more normal course, seeing a neuropsychologist and then a neurologist. And at a follow up for dad, mom mentioned a couple of stories of things going on with Mike because the neurologist said, "Oh, how are you doing lately?" And she said, "I don't know, I'm worried about my son in law," and then shared a couple things. And that neurologist said, I want to see your son-in-law in my office this Friday, the when she told him. And so, um, by getting Mike in front of an expert who'd had decades of experience, and that expert could look at scans that he had had and listen to a clinical background and examine him, it made him very suspicious that he had FTD. And then Mike had additional workup, um, but that was the accurate diagnosis.
So, as I understand it, there is a blood test to test, at least for the biomarker, right? If it's a hereditary and genetic. So, does that mean that there is not a test if you do not meet that biomarker? I know Spencer and I were talking about it. He said that there was the blood test. He can determine whether he is the carrier of this, and he'll inevitably end up with it. Does that mean that if you do not have that biomarker, there is no biological test you can do to definitively determine it?
So the way to think of it is, well, first of all, yes, there are blood tests that aid in the diagnosis of neurodegenerative diseases. So just to answer your question, but think of it this way, Andy. Alzheimer's disease, FTD, Lewy body, neurodegenerative diseases are complex conditions. So that means clinicians need to be detectives. They need a complex approach to accurately diagnose. Okay, we think this is neurodegenerative, but what kind? So that means families often they wait for months to see a specialist, and then they're disappointed when they go in for that one appointment and they think, "Oh, I'm going to get a diagnosis today." But that's not how it works because it takes time. So oftentimes clinicians need clinical history, exam, imaging, paper and pencil testing, like cognitive testing, like you might do with a neuropsychologist, or even just having like a Montreal Cognitive Assessment, the MOCA, in your primary care office. And then fluids, right? That could be asking someone to have a lumbar puncture so that they could look at spinal fluid. A blood test to check and look for infections or markers for Alzheimer's disease, which there are new FDA approved blood tests for Alzheimer's disease. Or then starting to look at genetics. You know, there are genes that can point us to say this person is likely to get Alzheimer's disease at a young age. About 15 to 20% of cases of FTD were able to connect back with the genetic form. But I think that genetics don't tell the whole story. It's really, what is the person living with? What's their
Hmm.
day to day? And those early symptoms might dictate where you go first. So whereas dad was having issues with memory, a lot of people would say, "Oh, ding, 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 memory. We got to check out his brain. Mention this to the doctor." Mike had just a lot of changes in his personality. And so that's why he ended up seeing a mental health professional first. And unfortunately, and very commonly, they started by saying, "Oh, you must be having problems in your marriage." Or for Mike, "Well, you must be having problems because you have a new baby at home." So it was a distraction from what was really going on, which was a medical condition, a disease in his brain.
How did you navigate it? Because realistically, you mentioned you had to build this support system through a skilled nursing facility. How else did you do it? Because I can't imagine that you can balance all these things. So how did you build a team? I assume you had a team of people that were helping you in different ways. Can you talk about that?
Yeah. So the first thing that I did was I made myself the CEO of the, Brandt McMullen caregiving team by leaving my job. So caregivers are likely to reduce their hours at work, turn down promotions, and leave the workforce entirely. Yeah, entirely. And that's why we say that caregiving is a threat to your physical, emotional, and financial well being. Women who are caregivers are significantly more likely to live in poverty. And that is what happened to me. So when I left my job, that had swift financial repercussions for our family because Mike also was not working. And so I lost our home to foreclosure. I ended up spending every dime of our retirement savings and then benefited from the social safety net in the United States, which is limited but helped us greatly through Social Security, Medicaid, and food assistance. And I was able then to focus on just every day being present to navigate the different healthcare providers, the different entities, all of the paperwork that I had to complete. It wasn't clear to me right away that I needed to thoughtfully and intentionally build a care team. I think with Mike, a lot of it was I have to put out this fire and that fire. Mike's course was so fast. But my dad, as I've been his caregiver for almost 18 years, has really taught me the importance of building an interdisciplinary care team. And so that I could really look at this as a marathon. Like, it's a huge part of my life. Not just a huge part of my day to day, but like a huge part of my life. I'm 46 years old and 18 years of it, I've been a caregiver.
That's impressive, and but it's also concerning that you mentioned you had to do a bunch of paperwork and get all the stuff sorted out. That is really lost time when you could have been caring for your dad, Mike, or Noah. So do you think that the bureaucratic natures that exist to get these social supports are taking away the valuable time from caregivers and caring?
Absolutely. My master's degree is in nonprofit management and public policy. And so I've thought a lot about how do we support vulnerable families? So, whether those families are vulnerable because of poverty, illness, systemic racism, what are the systems in place to help support them? And in the United States, you have to go to multiple offices. All of the social safety net resources that I just mentioned, those are each separate applications, offices, timelines, requirements. What families really need is help with care navigation. They need one stop shopping. They need to have things as simple as possible because the reality is most families are not benefiting from all the resources that are available because they cannot manage applying for another thing. They can't meet another deadline. They can't fill out more paperwork. They can't call again and again and again. So you triage every day, like what's the most important? Well, we had to have health insurance, so I had to figure that out. We need to eat food, and I think that there were other resources that I could have benefited from that I just didn't have time to access. And I remember I specifically hired a babysitter and a care manager, I'm sorry, a care provider for dad to like give me time when I had to fill out a Medicaid application for my.
Is this a federal issue or a state issue in America?
It's both because a lot of the federal programs, the way that money trickles down from the federal government, then it's distributed state by state. So that makes it all the more complicated because you have federal laws that mix in with state laws. So we need advocacy on the local, national, and the local, state, and national level.
I mean, it's concerning, Katie, that you mentioned that you basically had to deplete everything you had to care and really be an effective caregiver. I was having a conversation with somebody recently, and they were telling me that when they entered into care, the spouse of the person being cared for had a healthy nest egg. They were doing well. And as they were in retirement, then they started caring and they depleted every single dollar that that person had. And then the family had to come alongside and really support. And this person and I had this conversation. It's like, aren't these systems supposed to be in place so that as you go into retirement, go into those golden years, the families aren't completely devastated economically to care for something that, I mean, the dementias are the second highest cause of death around the world. So but the systems are putting yourself and this family on the hook for it, and it's taken decades for some of these families to get out of that hole. So I just wrestle with that. Like, how do we systematically support it? Even just caregiver pay. Like, there's one province in Canada where a caregiver, if they become a full-time caregiver, then they get a salary to do it. Not a significant salary, but it's something, contributes to you taking the time away from your job to do it. And I think like just that small difference can make a world of impact, because then you don't have to, like you said, bounce between all these offices, all these entities to go between social assistance.
Most I think that mostly what people need are flexible resources. So, in a lot of ways, like you just talked about, cash resources, income, that's what people really need because some folks will say, oh boy, I have to stay with my job. So I need this cash resource to hire someone. Or I wouldn't have to work. I would be able to stay at home, but I still need cash resources to keep the lights on and pay the taxes and the mortgage or the rent. People need to have flexibility and resources because we all have different uh, challenges and opportunities presented in front of us. Some of us have big families where a lot of people can pitch in and help. Other people are alone. They don't have a primary caregiver. We have to think about personhood and dignity and how, as a society, whether that's in the United States or Canada or as a global society, how do we care for our most vulnerable citizens? And unfortunately, I think in a lot of ways, the government hasn't been able to identify that. It takes the advocacy of people with lived experience, families, and communities to say, no, we need this to be different.
So how did you get into advocacy? What was the journey like to go from caring for Mike, caring for your dad, helping Noah as he grew up, into, supporting the Boston Mass Hospital?
Oh, yes. So that was a really interesting transition. Mike um, had such a fast journey. So he was diagnosed in 2009 and in February of 2009, and he passed away in April of 2012, just after Noah turned 4. And I knew that I would need to go back to work, but I just felt like I had lost all my energy from my previous career. And I felt like this big, horrible thing had happened to our family, and it just seemed like no one noticed. Like, in many ways, caregiving is just so isolating. And I wanted people to know what happened to us. I wanted Noah to know that his dad's life was important. I wanted this experience to mean something. Mike had received care at the Massachusetts General Hospital Frontotemporal Disorders Unit. His doctor was the director then and the director now, Dr. Brad Dickerson. And after Mike passed away, I approached Dr. Dickerson and I said, I think you should hire me as a consultant. And I don't think he really knew, what to think of that. And I said, just hire me for 6 months. I promise I'll raise more money for you than you'll spend on me. And I want to work on the materials that you have for families related to brain donation. And so he gave me a chance, hired me just as a consultant a few hours a week. I was able to plan a black tie gala with a wonderful committee of other volunteers. We raised $100,000 for the unit that first year. And then I did help work on the brain donation portfolio. So Dr. Dickerson offered me a part-time job in the unit. That was in 2014. Then in 2018, I became the full-time director of caregiver support services. And this allowed me to reclaim my identity as a professional. And it also allowed me to channel the energy that grief created in my life into something positive. I knew that I was going to need an outlet for that grief energy, and I didn't want that outlet to always be at home. I wanted to be present as a parent when I could. And I was able to keep my dad at home for 7 years. And then dad had more medical needs. And one day I looked around and I thought, I've turned my home into a skilled nursing facility. And I didn't feel like that was good for me or Noah. And so then we employed the help of memory care. And it has allowed me to work more. Like having full time care for dad allows me to work and be the provider that Noah needs.
So, what is Noah's perspective on this? Because obviously he was really young um, when this was all going on. So, what does he think about it now?
I've had some really amazing experiences with Noah, in particular this past year. Noah's now 18 years old. He's about to graduate from high school. He's going to Northeastern in the fall. We're so proud of him. And last June, I was talking with the director of public policy for the Rhode Island Alzheimer's chapter about my upcoming trip to Washington, D.C. to be part of the Alzheimer's Impact Movement, the Alzheimer's Advocacy Forum, where we go to Washington, D.C. and, advocate with elected officials for policies and programs that help families living their lives with dementia. So I got off the phone in the car. Noah had been listening in on the conversation. And he said, "Hey, Mom, can I join you?" And I was like, "Oh, Noah, it's going to be a work trip. Like, we won't be able to sightsee. I don't think you're going to like it." And he said, "No, like, I want to be an advocate." And it was just so amazing that Noah decided on his own. I mean, I had to bring him to so many events over the years as a single working parent. But for him to speak up and say that he wanted to be an advocate on his own, and it was so amazing to listen to him talk with the elected officials about the impact on his life. One thing that stood out to me that he said, which he hadn't communicated with me before, was, of course, it's awful for the person with the diagnosis, his dad, his grandfather. They lose their lives to these diseases. But it's also awful for the families left behind. Because while the people with dementia are losing memories, as Noah said, he didn't even have the chance to make the memory in the first place because FTD didn't allow his dad to be present. Alzheimer's didn't allow his grandfather to be present in the way he would have wanted. So I thought that that was very profound in a lot of ways. And of course, made me feel so proud of him for speaking up and speaking out.
How did you message this to him as he was growing up? Because obviously there's questions. I know in the short film, one of the questions that you mentioned that he asked you was, did you and Mike hang out when you were younger? So obviously he couldn't connect the marriage when he was young. So how did you convey that to him as he grew up?
Yeah, recently someone asked me, well, let me take one step back. A lot of times people can be diagnosed with having dementia, and then families are not quite sure why, right? It could take some more detective work to get to, well, what is causing the dementia? And for Mike, it was really important when we understood what was causing his changes. So recently someone had asked me, like, what did a diagnosis give you? Like, why was that important? And I said, oh, that's so easy. It gave me back our love story. Knowing that the reason why Mike wasn't present in our lives, whether he wasn't able to be emotionally present or physically present, why did he leave us? Knowing that it wasn't his choice, it was a disease, it was a medical issue that took him away. Being able to communicate clearly to Noah that his father was so excited about him, about becoming a dad, about being a family, and that it was this disease that we didn't even know existed, um, that took him from us. It, I think, helped Noah to know that there was love there, um, but at the time, love wasn't stronger than FTD.
What would you say the people that are genetically predisposed to these things, that say Noah, right? His grandfather had Alzheimer's and his dad had FTD, so he is genetically more disposed to it, whether he gets it or not. Lord willing, he doesn't. But if he does, what would you say? How would you navigate the possible impending
Well,
that
I
could
think
happen?
that we should all think about our brain health. Everyone should think about that. And the reality is, all of us are going to age and need care. I mean, what happened to Mike is shocking. My story is so unusual. How in the world could that happen to somebody in a 21-day span? We all need to think about, how can we make our brains as resilient as possible? Number one, making those good lifestyle choices. Number two, when something pops up that we're concerned about, how can we be open with our healthcare providers and request that evaluation, to check on our brain health? I think that in the past, people were terrified to bring it up with their doctors because there was absolutely nothing that could be done. Today, we have the first disease modifying treatment for Alzheimer's disease, and we have multiple companies engaged in clinical trials for FTD therapeutic interventions. By being brave and talking about your full, um, clinical or health history, like your family's full history, that can clue your provider in on what are the things that they want to look out for you to manage your risk. And, how could you think about if participating in research is right for you? And you can also think about, how can I plan ahead if I need care, whether it be from a disease that causes dementia or a cancer or something else? I think that we all need to be a little bit more direct about planning for aging and planning for care.
What advice would you have then for a caregiver? Let's say it's a wife and their husband in late 20s, early 30s gets diagnosed with FTD. What advice would you have for the first day, week, month, year?
Well, I do have three things that I tell people after they receive a diagnosis. I have the privilege of working in the Mass General FTD unit clinic, where people do receive diagnoses and then we help them manage the disease and symptoms. So after you receive a diagnosis, there are three things that I think that can really help you. The first is, share this diagnosis with someone who you love and trust. Share this with your inner circle, because you're not going to be able to navigate this alone. At the very first stages, you are going to need emotional support, kindness, grace, a listening ear. So share that with someone who you love and trust. If you don't feel comfortable doing that, share it with your mental health provider so that you can make sure you're getting that emotional support. The next thing to do is connect. In the United States, I would say you need to connect with a certified elder law attorney. In the United States, certified elder law attorneys are the attorneys who help families with estate planning, and they are the best educated, the most knowledgeable about laws res- related to estate planning and advanced care planning. So Number one, you're going to talk to someone you love and trust for emotional support. Number two, you're going to reach out to an attorney. You're going to share your diagnosis with the attorney and you're going to say, I need help doing legal and financial planning with the thought that I may need a high level of care or my loved one may need a high level of care in the future. And they're going to know, what to do. If your attorney says they've never helped anyone who's has a diagnosis of Alzheimer's or FTD or dementia, you need a different attorney. So if your attorney helped you with your real estate transaction or, something like that, that's probably not the right attorney. You need an attorney that has experience helping people make long-term plans. So one, talk with someone. Two, with someone you love. Two, attorney. Three, you are going to make a commitment to connect with your patient advocacy association. So that means if you have Alzheimer's disease, you're going to connect with a local support group at your hospital. You're going to connect with the Alzheimer's Association in your country. And what does it mean to connect? You're going to commit to going to one support group, or you're going to sign up for an email list. You're going to attend one webinar or educational event. Why is it important that you do this? Number one, I want to make sure that you are not just Googling at midnight and getting information that's not accurate and might be scary and might not even be relevant to your diagnosis and situation. I want you to get information from a trusted, safe source. Number two, we don't have a cure for dementia today, but we do have a cure for the isolation and loneliness that can come along with a diagnosis. You need to know that there is an entire community waiting for you with open arms, with support, information, friendship, camaraderie. And do not deny yourself entry into this community because you are going to need them.
Did Mike realize that he had FTD? Like, what was the dynamic like at the appointment where they said, Mike, you're living with FT or however they phrased it? What was that like, and how did he take it?
No, Mike had a very strong case of what is referred to as anosognosia, which means that anosognosia is when you don't recognize that you are struggling or have a problem. So when Mike was diagnosed with dementia, but I don't know why, by that neurologist, that first neurologist, as we were leaving the appointment, she called down the hallway to me. She said, and by the way, he shouldn't drive. That's great advice. So we had two cars at the appointment because I met him there after I was at work. And I was like, well, I'm going to let him drive home, I guess. So we went home. And I remember, I think it was that night or the next day, but he wanted to go somewhere. And I said, oh, remember the doctor said you can't drive because you have that cyst in your brain. Like, obviously it's not the right language, but this is the language I had at the time. And he said to me, there's nothing wrong with my brain. And in that moment, I had such an experience of like understanding that one, I was all alone in this. Like Mike and I were not partners. What grief and sadness to know that my wonderful husband, who was an incredible partner, couldn't be there with me to navigate this. And two, I was going to have to take a different approach. I was going to have to join Mike in his reality. So instead of telling him that he couldn't drive because there was something wrong with his brain, then I just said, oh, the car's making a funny noise. I'm going to drive. Come on, let's get in the Honda. Just really taking on as much of it as I could. And what helped to eliminate friction was I stopped asking Mike to do things that he couldn't do. So I didn't ask Mike to help me make decisions. I didn't ask him to have conversations with me that he wasn't capable of, and that reduced a lot of friction, and I just tried to provide him with support and understanding.
What has been the impact of your advocacy work? Even going to Washington, like, what is the impact of all the work you've been doing over the last decade?
Well, the collective work of the Alzheimer's impact movement has created billions of dollars of investment in scientific research for Alzheimer's and related dementia. The collective advocacy work has expanded policies that used to only provide services for people with Alzheimer's who are elderly to expand to people with dementia of any age. In my time on the National Alzheimer's Project Act Advisory Council, when I was co-chair, I contributed to adding a additional goal to the National Alzheimer's Plan, which was prevention. So that focus on what education, services, infrastructure can we put in place to help people live healthy lifestyles so that they can try to keep their brains strong against Alzheimer's or dementia later in life.
One interesting thing, Katie, that you were involved in was Emma's book. Can you talk about how that came about and what, impact you've seen from that book? I know we've talked about that book before on the show here and the impact and normalization it's had for dementia. Can you talk about the journey leading up to that and after it's came out?
Yes. So you're referring to The Unexpected Journey, written by Emma Hemming Willis, wife of American actor Bruce Willis. It was really beloved around the world. And of course, I had heard the news that Bruce was living with FTD, and then saw that Emma was starting to become engaged with the Association for FTD. At the 2024 International Society for FTD conference, we were in Amsterdam, I presented a workshop about the care plan trifecta, which is a model of care that I use with families to talk with them about care planning to support that themselves and the person they love while navigating life with dementia. And Emma attended my workshop. She was sitting in the back with Dr. Dickerson, and I was surprised to see her there, but realized very quickly upon meeting her after the workshop that she is like every other caregiver that I've met, just desperate to learn ways to navigate this disease and suffering because of the emotional loss and the lack of infrastructure to guide families after a diagnosis. So as Emma and I, continued to talk, I think that she saw value in some of the messages that I had for families. And she asked if she could interview me as an expert for her book. So her book features 25 experts, just incredible individuals who are helping to make lives better for people living with FTD and all dementias.
I think as as terrible as it is that Bruce has had to go through this journey, I think his journey and the fact that they haven't hidden, they've been very vocal and talked about and shown it, I think has done an amazing thing for, breaking the stigma of they have a dementia, let's hide them away and not talk about it. Instead, it's this is a real thing that happens to so many people. This is the journey. This is what it looks like. This is the harsh reality of what it looks like. And I think as hard as I imagine it would be for Emma, I think there's a lot of families that are probably appreciative of that and yourself and these other individuals that have been through it and are talking about it now instead of hiding and saying, this thing happened, but I don't want to talk about it because it's personal. Instead, it's this happened to me. It's raw and it's real and it's natural, and don't feel bad about it. Instead, try and build this community, build these people around you to support. And it's just amazing to see the change over the last handful of years.
Exactly, and what a brave and courageous thing the Willis family has done by being open. I do know, though, that being open has also left them open to judgment and sometimes, harsh criticism for the care choices that Emma has made for their family. And what I would say about that is sort of getting back to one of the earliest questions that you asked me at the top of this interview, which is about the feelings of guilt. And I think that people are put in this very difficult position when their loved one receives this, you know, terrible diagnosis of Alzheimer's or FTD, in that they're asked to rise to the occasion to be a caregiver with no formal training, without even knowledge of what is ahead, sometimes with other incredible pressures like, okay, well, now I have to be the breadwinner for the whole family. I'm continuing to raise kids. And there is so much pressure and expectation put on family caregivers. And sometimes people need to make decisions to whether it's, okay, I'm going to be at home and care for my loved one with our family as much as possible, or I'm going to fully use the support of an outside entity. And just I would love to plant the message that I really believe that all caregivers are doing the best that they can with the situations presented to them. And that if you find yourself judging another caregiver for their decisions, really check in with yourself. If you've never had the experience of caring for a loved one with dementia, or maybe you did care for a loved one with dementia, but their symptoms were a lot easier to manage. So just know that every person living with dementia has different symptoms to varying degrees of challenge, and every caregiver has different resources and abilities. So just being gentle with yourself and with others around you, and knowing we're just all navigating in many ways things that are uncharted.
And I think instead of challenging and critiquing, it's a sign saying, "How can I support you? Is there anything I can do?" I mean, I'm not saying we need to make a meal train, but just something small. I'm at the grocery store. Do you need me to grab something for you? Just these small little things, or you know what, you're doing good, you're doing great. Keep up the good work. Something small. I think oftentimes it's those little simple things that go a long way to show that we you're not in this alone and you have the support because like you said earlier, you were kind of the world was crashing around you and you felt like everything was on fire and you just had you and Noah. So how do we help you not feel that way? Help you feel like you're supported? I think that goes a long way.
Yeah, when I think about the people who made me feel the most supported, they weren't people who knew anything about dementia care. They were the girlfriends and the people in my life who would send me a text, "Hey, thinking about you today. Saw something funny. Want me to come over for a movie night?" It was the people who came over. I love to host dinner at my house because, sometimes taking dad or Noah out would have been difficult. But if people came to us, and, I'm a very social person, so I really crave those, friendships and the time with extended family. So I love what you just said, so it would be wonderful if people listen to this podcast, this episode, and if you know a caregiver, if there's a caregiver in your life, commit to sending them a text message today that just says, "I'm thinking of you," and sending a hug your way. "I'm thinking of you. Do you want to talk on the phone this week? I'm thinking of you. How about a cup of coffee?" That would be wonderful.
One important caveat, Katie, I would have is that once the battle is over and the person passes away, like happens, don't just immediately disappear. I know I've seen it firsthand in my family that people are like, "Hey, we're here to support you." And then after my grandmother passed away, everyone's really I stopped getting the messages about it. People stopped reaching out. I don't know if it is they don't know what to say. Maybe they don't want to say anything inappropriate, or I don't know what it is, but I think it was common. I'm going to back up and maybe give this person space. But that's maybe not what we always need. Maybe we need a little bit of conversation about something totally different, like movie night or something light. But I think just while they're caring is not the only time that that is necessary. It's sometimes on the tail end after that it's so impactful and important.
I've been able to run the Boston area FTD caregiver support group for about 12 years now. And we have this wonderful group of caregivers who attend, but we also have this group of alumni caregivers. And these are caregivers who their loved ones have passed away, and they continue to come back to group. It's a group of about 10 people that come in and out. And so we ran a focus group with them lately and asked them, like, why? And of course, many of them talked about that they receive so much from group and they want to give back and help others. But there were other caregivers who were really open, talking about, well, this is a place where I feel safe. There were other caregivers who said, this is a place where I feel safe to share my grief and loss. Because in many ways, people outside of their bubble with their loved one, like their loved one was already gone from they were gone from their place of work. Maybe they weren't as present at family holidays. And so that loss had happened already for many people outside of the inner circle. But that caregiver is experiencing an incredible loss, not only of the person they loved, but also of their identity as a caregiver. So it's just very complicated. And knowing that, yes, these people in your life with caregiving experience, they would benefit from your friendship and your support. And it doesn't have to be about dementia caregiving. It doesn't have to be about grief. It's just about being human.
Well, Katie, it's time for lightning round. Coffee or tea?
Coffee.
Calf or decaf?
Calf.
Ah, we're 40 some episodes in, Katie, and I haven't had one decaf person yet. One day, Katie, I will have it and I will ring that bell.
I mean,
One day.
I love a decaf cappuccino at night if I'm at a restaurant. I always want that.
Uh, morning bird or night owl?
Night owl.
Yeah, okay. What is one word that best describes Mike?
Gregarious.
Ooh, big word. What is one thing about FTD you wish everyone understood?
That it changes your loved one's personality on the outside, but inside they are still the person that you love and the person that you knew.
What is one word in caregiving you wish would disappear?
Like, angel, caregiver, pure of heart, selfless. I think caregivers are not these perfect beings. They are people with flaws, but they're just trying to show up and love their person.
On the other side, what is one word caregivers should use more?
Boundaries.
What is your best meal that you cook?
Enchiladas with sauce from scratch.
Interesting. Not what I expected for someone from Boston making enchiladas.
That's what my son would say. His favorite meal is I've made it for years. I have the own recipe to make the sauce. It's wonderful.
Wow. Where did you pick up the recipe from?
It was America's Test Kitchen cookbook years ago, and then I modified it a little bit with Penzeys bold taco spice.
Oh, interesting.
Mm-hmm.
Interesting. What is one sign of burnout you wish people wouldn't ignore?
Sleeplessness. So having trouble winding down to rest. Like when you can't sleep, it's actually means you're like too wound up.
What food reminds you of your childhood?
Irish bread that my dad's mother taught my mom how to make, when they were engaged, and mom used to make it every Christmas, so I continue to make it.
What is one habit that makes care harder than it needs to be?
One habit that makes care harder. I think the habit of saying no when it comes to taking respite for yourself. So the habit of not taking breaks.
What is a misconception people have about young caregivers?
That because they're young, they have the energy to juggle it all. Caregiving is depleting no matter what age you are.
What show or movie helps you reset on a hard day?
Grey's Anatomy.
Are you into the pit now that's coming up as well?
I have seen The Pit, but Grey's Anatomy I love for, like, the drama, and it's like the soap opera, I think, like, my mom used to watch soap operas, and I think, "Well, that's what Grey's Anatomy is for me."
What are they, 18 seasons in or something now?
Exactly, like, there's so many. Yeah, I could never run out.
They're starting a sequel, I heard in Texas apparently.
Wow, great, can't wait.
Yeah. Haven't seen it since season 1, but apparently they're doing a Texas spinoff. Uh, what book do you think best understands grief?
Well, I actually tried to read a lot of books about grief and loss, and a lot of them didn't do it for me. My favorite book that I've turned to time and time again that helped me feel resilient is Super Survivors. Um, the surprising connection between suffering and success. And it's written by two psychologists, and it's about people who experience trauma, and then they don't just come back, but they come back stronger. And all of the cases that they profile in the book are just regular people. And so I read it over and over, and I thought, if these people could do it, why can't I?
So true. So what does dignity mean to you in one word?
Choice.
What's one hobby or interest you would love to return to?
Well, I was like the yearbook photographer in high school, and I used to develop my own prints, like,
Okay.
really. So I think it's just time and space. But, my iPhone is a great companion. But yeah, I'd like to spend more time with my Nikon, I think.
Do you think that digital loses some of the effect that we gain from film photography?
It's just different. Like, I think initially it did, but now, like, just the advances, it's just so incredible. And so almost like original film photography, it's its own art form.
So what keeps you doing all the advocacy work?
I think for so long, I would have said Noah, and it still will be Noah, but now Noah is ready to launch for college. He's not a little kid anymore. I don't have to prove to Noah that his dad's life was important. He knows. I did it. I achieved that. And so why am I continuing to do it? Because I think that I'm uniquely positioned to speak uh, on behalf of my own experience, on behalf of the people that I love who have lost or are losing their lives to dementia, and on behalf of all the people who don't have the ability to fly to DC, who don't feel comfortable behind a microphone. I feel called to do it to help others.
What is one thing you'll never stop being curious about?
Uh, Relationships.
How
I
so?
am so curious about how we form bonds with one another, fall in love, and how love and relationships can get us through so many hardships.
What is the most human thing that has happened to you lately?
But the most human thing that has happened to me lately, I think it's well, I had this lovely experience for my dad's birthday. I hired this group called Blazing Saddles, and they brought farm animals to my dad's nursing home. And I got to help my dad hold a baby lamb. And they told us that this lamb was the runt of the litter and it was losing weight and they thought it was going to die. And then someone in the family had an idea to put the lamb in a baby high chair to feed it its bottles during the day. And that has made all the difference. Now the lamb is gaining weight and thriving. And I think that was a very human experience because dad and I were both present petting this baby lamb. And it was a shared experience that we both had, even though dad can't really communicate with me what that means to him right now.
Wow. What gives you hope right now?
The incredible community of scientists and clinicians that I get to work with through Mass General, through the All FTD research study, through the International Society for FTD, because what I see from them is real love for the patients and families they care for. And then that love and support inspires the families to want to participate in research, to give philanthropically. But it's this community of scientists. I feel so grateful that they chose us as their life's work.
Katie, I always leave the guests with the opportunity of the last word for the audience. What would you have to say to them?
My last word will be something that I have come to decide that hope is not enough for me. You just asked me about hope, Andy. Hope's not enough. I focus on what I know. And what I know is that there are people working really hard today to make sure that tomorrow looks different. I know that families' love is an unending well, and they're going to keep showing up again and again. And I know that if our persons with dementia could speak clearly to us, they would tell us that they appreciate everything we're doing for them.
Well, Katie, thank you so much for joining us today on the show. I really appreciate it, and it really was impactful. I know that I took a lot away, and I know our listeners will as well. So thank you so much.
Of course. Thank you, Andy.
And to our listeners, thank you as well for being here. If today's conversation resonated with you, make sure to follow the Dementia Collective wherever you get your podcasts. And don't forget to like, comment, and share. You never know who will need this episode. And if you'd like to help us grow this movement, please consider becoming a member of the Village on Patreon. Among the benefits, like the ability to ask questions to our guests, you'll get early access to every episode, plus the satisfaction of helping powerful voices like Katie's reach more caregivers around the world. And finally, if you're on your own caregiving journey, remember, you are not alone. We're here at BlueBell to help connect you with the supports and resources that truly fit your family's unique needs. Until next time, remember, you are strong, you are not alone, and you're doing something that matters more than you know. I'll see you next time.